Good afternoon, folks. Now, topic A is going to be done a little bit different today. I'm doing an essay for you on the show about long-term care. For those who don't understand what long-term care is, I'm going to do a presentation on America's long-term care today for A. So here we go. Long-term care is one of those parts of American life that everyone knows exists, but few people truly see. It lives in the margins of our attention. A phase on a policy brief, a line item in a budget, a distant worry we tuck away until it becomes urgent up close. Though it is not a policy problem or a statistic, it is a human landscape of small, relentless moments. A hand smoothed over a fevered brow, a laugh that arrives like a surprise, a silence that stretches too long. Those moments add up to a life being lived and a life being tended, and they deserve to be seen. Most Americans encounter long-term care the way one encounters a storm on the horizon. Aware of its presence, vaguely uneasy, but convinced it will pass them by. We imagine it as a place other families go, a chapter reserved for someone else's parents, someone else's spouse. But aging is not an abstraction, and neither is it decline. When the storm finally arrives, when a fall, a diagnosis, or a slow unraveling of memory forces the issue, the world contrasts. Suddenly, long-term care is not a distant system, but a daily reality, one that reshapes routines, relationships, and the very definition of home. I first learned how invisible it could be the day My mother stopped recognizing the kitchen where she had cooked for 40 years. The room was the same, but the map she used to move through it had been erased. Watching her search for a name, a memory, a familiar face, I felt the world narrow to the size of that kitchen table. Around us, the staff moved with practiced gentleness. Family members traded practical instructions and private grief. The building hummed with routines that both sustained and exhausted the people inside it. That intimacy, the mixture of tenderness and strain, is what long term care really is. And it is what most of us never see until we are forced to see to until we are forced to. Long-term care is not a single place or a model. It is a patchwork of nursing homes, assisted living facilities, memory care units, home care agencies, and unpaid family caregivers who form the invisible backbone of the system. It is shaped by Medicaid rules, staffing shortages, reimbursement rates, and decades of political neglect. But it is also shaped by love, the kind that keeps adult children awake at nights, the kind that makes a spouse lift a body heavier than their own, the kind that makes a caregiver stay past the end of a shift because someone's mother is frightened and needs a familiar voice. This essay will pull that curtain back. I will trace how long-term care became both indispensable and overlooked, examine the human cost hidden behind institutional walls, and argue that seeing this part of our lives clearly is the first step toward treating it with dignity it requires. If we refuse to look, we accept a system that asks too much of families, too little of institutions, and too often sacrifices the quiet dignity of the people it is meant to protect. Below is a polished, formal, written testimony on long-term care, tailored for a legislative hearing and written in your voice as a healthcare system provider. It is a structured, authoritative, and aligned with the operational realities you face in Pennsylvania and across Northwest Pennsylvania. Okay, guys, here's the second half of my presentation for A. Give me 2 seconds, please. Long-term care reform. All right, guys, I'm going to talk about state long-term care in Pennsylvania. Okay. My name is Felicia, and I do senior health care within a regional healthcare system in northwestern Pennsylvania. I appreciate the chance to share the perspective of those of us who see every day how long-term care gaps directly affect hospitals, families, and the broader health of our communities. Long-term care is often discussed as a social service issue. In reality, it's a core healthcare infrastructure issue, one that shapes hospital capacity, workforce stability, and the financial sustainability of health systems across the Commonwealth. When long-term care fails, hospitals absorb the consequences. And when hospitals are strained, entire communities feel the impact. The operational realities outside our hospitals. In my health system, we routinely care for patients who are medically ready for discharge, but cannot leave because no nursing home bed is available, or because home care agencies cannot staff the case. These delays, sometimes lasting days or even weeks, create avoidable inpatient days, reduce bed availability for higher acuity patients, and contribute to emergency department boarding. We also see social admissions, situations where a caregiver can no longer manage at home, and becomes to the patient comes to the hospital not because of a medical emergency, but because the long-term care system has no capacity to support them. These admissions strain margins, increase staff burnout, and reflect a system that is failing the people it is meant to protect. This is not an isolated problem. It is a daily operational reality across Pennsylvania. Why long-term care reform matters to the Commonwealth. A hospital throughput and capacity. LTC bottlenecks, slow discharges, increase length of stay, and reduce access for patients who truly need acute care beds. This reflects everything from surgical scheduling to emergency department flow. Financial sustainability. Under value-based care models, LTC instability drives avoidable readmissions, avoidable emergency department visits, and avoidable post-acute drift, all of which erodes shared savings. Performance and increase uncompensated care, workforce stability. When LTC providers cannot staff cases, hospitals, nurses, and care managers become de facto LTC navigators. This diverts clinical time, increases burnout, and worsens retention challenges. Community health and trust. In rural regions like Meadville, the hospital is the anchor institution when LTC options are limited or inconsistent. Families lose confidence in the entire care continuum. The system must deliver a stable financial foundation. Families should not have to spend down to poverty to access care. A federal or state catastrophic LTSS benefit would protect middle income households and reduce the bottlenecks that keep patients in hospital beds. Expanded home and community-based services. Most Pennsylvanians want to age at home, strengthening HCBS is one of the most effective ways to reduce avoidable utilization and accelerate safer discharge. A stronger direct care workforce. Direct care workers are the backbone of LTC competitive wages, standardized training, and career ladders, the core of workforce. Investment are essential to stabilizing the entire continuum. Transparency and accountability. Public dollars must reach the bedside. Transparency reforms, including reporting of ownership, staffing, and related party transactions, ensure that rate increases translate into real improvements in care. What success looks like for Pennsylvania: fewer patients, fewer patients stranded in hospitals and hospital beds, faster, safer discharge to home, lower readmission and emergency department visits, a more stable and reliable LTC workforce. Families protected from catastrophic financial loss. A system that treats aging with dignity, not crisis management. These outcomes are measurable